All right. How's it going, everybody? This is Eric with Motion Guidance, and coming at you today with today's topic of billing and coding while using the motion guidance system. So, this is a big topic for people who are just getting used to using the motion guidance system more in their clinic, as well as trying to diversify how they can drive extra revenue. So, we'll be talking a little bit about CPT codes used in skilled therapy, as well as utilizing the device and being able to maximize the amount of billing and coding that you can use while using the motion guidance device in clinic. And then again, we'll come back around to the topic of patient packs. This is going to be super important for those that are interested in generating extra revenue through their clinic. And so we'll wait another few seconds, let some other extra people jump on, and then we'll get to this topic. Today, I'm coming at you from Castle Rock, Colorado. We had a lot of snow this week, and I know some people in the Midwest and over to the East Coast of the United States are also getting some pretty big storms. So we hope everybody's staying safe and warm out there. So let's talk CPT codes and billing and coding. So probably the biggest topic linked into that group is how to make sure you're diversifying your charges. So it's important to understand that you have a litany of CPT codes that you can be using while you're using the motion guidance device, as well as some extras that might be unknown to you on other ways that you might be able to maximize. So we have our typical codes, the 97110 for therapeutic exercise, neuromuscular reeducation, and 97112. Gait training 97140, therapeutic activities at 97530, and then even biofeedback at 90901 and 90911. So utilizing the motion guidance device, you should be able to utilize every single one of these codes at some point. The only one that can be a little tricky is the biofeedback codes at 90901 or 90911. You're going to have to check with the insurance to see if they're going to cover this particular code, if you're going to use it under an insurance coverage. And you're also going to have to see if that's a timed or an untimed code. Most of the time, that's an untimed code that you're going to be using for biofeedback, but it should be able to be paired, if accepted by the insurance company, with any of the other codes that I mentioned. So if we apply motion guidance to any part of the body, whether it's head, neck, for example, for a concussion, or acute torticollis, or generalized neck pain, or whether you're utilizing that on the quadriceps during terminal knee extension for gait, you're going to bill for the time that you're utilizing for the action and not actually utilizing for the device. However, if you are taking the device away and that switches the exercise, you may be able to use a different code during the off period. So if you have a person that's doing specific neuromuscular reeducation for strength and conditioning of a post-operative state. So let's say you're doing a straight leg raise and you have the motion guidance device on the quadricep and it's pointing toward the toe, as you've seen in a lot of our videos on social media. Doing the quad set and then doing the leg raise, you may want to do groups of exercise that are utilizing the motion guidance device, having it on the foot for a set and then off the foot for a set. That might change what you're trying to achieve. So if you are utilizing the straight leg raise with the motion guidance device on, and you're having them use an external focus of attention to perform that activity, as you go through that for a few groups, you might switch that to turn the motion guidance laser off and then finish off with just general exercise after that. And that might utilize more of a 97110 therapeutic exercise code. So you could pair those two together. You can also switch as you start to utilize motion guidance and they are using it for a therapeutic activity or a neuromuscular reeducation code. As your patient continues to come in and they are starting to master the exercise and they are moving past the need for the motion guidance visual feedback, then you can start switching that particular exercise into a more diverse code of a therapeutic exercise. So if you were to say, hey, your leg raise looks good now, but we're still going to utilize leg raises just to get some exercise today, you would put that under 97110. But then if you are still working on some gait training and giving them terminal knee extension or heel strike using the motion guidance laser, then you can utilize either gait at 97140 or therapeutic activities at 97530. And at the same time, if they're covered, then utilizing a biofeedback code to maximize your billing and coding for that particular patient. And you can, of course, interchange that with any exercise that you're doing. If you're doing head neck things, we typically will put most things under the code of therapeutic activities. If you're doing things like saccades or a VOR assessment, or you're looking at joint position sense air, and that's going to be the most reimbursed code for that. If you're doing more of a motor control activity, that could still be a therapeutic activity, but if you had to then switch the code to maximize the amount of billing codes that you can use in a session, you could switch going through the motion maze into a neuromuscular reeducation type of activity, or use the butterfly pattern to do the tracing, and you could sit in the same session with multiple activities and get different codes out of each of those activities. All right. The other important thing to understand is then transitioning them into use of patient packs. So if they're getting the benefit in the clinic, but they require the visual feedback, and especially you're noticing that they are regressing or not progressing through their exercises between sessions, then we encourage you to get them a patient pack. So remember, patient packs can be found in bulk quantity on our website at motionguidance.com. They are coming in 5 packs with the discount already built in. So you're going to have the $69 single pack available on our website, as well as resources like Amazon.com. But if you bundle those together in groups of 5, then the price comes down to $44 each, and then you can resell those to your patients. So you're making a $25 profit before taxes by going the bundled route and then giving those out. So I really get the question a lot. So Eric, Dr. Dinkins, how are you utilizing patient packs, and what patient populations are you utilizing those the most for? So in my particular clinic, I do see an eclectic mix. So I will see concussion and vestibular patients, and I will see a lot of post-operative patients. And those are the people that I utilize the patient packs the most. So if I have a patient on my schedule and they are a total knee arthroplasty, they are an ACL reconstruction, they're some type of debridement, then those patients I encourage to get a motion guidance feedback system on day 1. They're going to need to see that their quad is under control. We're going to utilize it for at least the first 8 weeks of skilled rehab, progressing from a quad set and a straight leg raise to utilize it for gait training for home, to utilizing it for double limb closed kinetic chain activities, single limb closed kinetic chain activities, and all using those differently. So I really encourage them to get one up front to maximize the rehabilitation. The other population is that concussion population. So because they can be so volatile, of course, we're encouraging them early on to be physically active and low-grade, well-tolerated aerobic activity, preferably things like walking outside is really beneficial for that population. We're seeing consistently in the research. So that we want to get them active, but we also need to know that their eye reflexes, their ocular motor systems mixing with their vestibular system are working perfectly. So that's the other patient population that I encourage to get the patient packs on day 1. If we get them the patient pack, then they can see their progress and they can also see their deficits. So in an example of saccades or VOR, if they're looking between two points and they get a motor cheat by a little tick-tock motion when they're looking to one side or the other, they'll be able to see that with the laser. And especially, I'm noticing a lot of benefit with my patients with carryover between sessions if they're utilizing it for a hypotonic dysfunction to one side, hypometric dysfunction to one side. So with the VOR, remember, we can see those on our previous talks or on our YouTube channels or our Vimeo channels, of where people tend to go toward their dominant side and not go toward their hypofunctioning side. So the laser is going to dominate to one side, and they can make sure at home with the patient pack that they are getting equal translation of the laser to both sides, to make sure that that VOR normalizes. That's the number one thing I see in my clinic of people coming back in. They're not making progress, and they continue to do what their body wants, which is toward their already well-functioning side, and they're not going to their deficit side with the VOR. So those are the two main patient populations that I'm seeing with utilizing patient packs. Of course, chronic pain can be a big one, things like fibromyalgia, and having them understand how they're moving and going through well-tolerated movement and getting the motivation of the laser. I've handed out plenty of patient packs for that population. I've also gone with chronic back pain. So they're understanding their low tolerance to exercise can be built up over time, and we can use the laser, as you can see in some of our tutorials on our social media channels, of utilizing how to hold the laser still, but then also promote motion over time with the laser. And so that's another big one that I use patient packs for. So those are the key tidbits for today, utilizing different coding to maximize your billing, and then trying to get patients patient packs to maximize the benefit and their value of what they're getting from your clinic. I'm just going to take a quick second, and if anybody that's viewing right now has a question they can throw into the chat, I'd be more than happy to answer that. So we'll just take a few minutes here and see if anything's coming in on any of our other channels. All right, guys. So it looks like everybody's comfortable with that topic. So I hope this really helps you out. Don't forget, to go to our resources at motionguidance.com, at Motion Guidance for Instagram and for Facebook and for Twitter. And we also have an email option for people on the website if they just have questions to get a hold of us. So I hope you have a wonderful day, and we'll see you in a couple of weeks for our next topic. And you can check the website for all of our upcoming topics. All right.